Hi, myself Abhishek Solomon. I'm working as an assistant professor in the Department of Trauma Care Management in the School of Allied Health Science, Yanapaya deemed to be University. So today topic we are going to talk about the roles and responsibility of EMS. So many people doesn't know what is EMS system and what is happening with the EMS system. So today we are going to talk about the roles and responsibilities. But before directly jumping into the roles and responsibilities, I want to give a brief introduction about how the EMS has been evolved. It's nothing but the history of EMS. So when the EMS system is started, there is actually no name such like EMS system. They actually started the EMS system to transport the patient from the battlefield to the safe zone. So initially they are just like a transporters. So in the year almost 14th century they have started. So that time they have started this like as a load and go. So the load and go is nothing but loading the patient to the structure or an ambulance from one place and shifting the patient to the safer zone for the treatment. So that time the EMS are not treating any kind of injuries or illnesses. Then gradually the EMS system has been grown. So coming to the history, when the EMS system is started is, the EMS system has been started in the year of 1487. So that is the first recorded EMS system or ambulance service which has been introduced. Then later on it has been grown. So this is the first EMS ambulance. So they are basically started with the horse cart where they are trying to shift the patient from the one place to another place. Then in the after continuously 300 years later, almost 3 centuries later, the proper EMS system has been developed. So why they started is, they started because of the emergency medical service to treat the patient, because they started research to treat the patients. So what happened, they did a research and they tried to find out they can take care of the patient illness at the scene before reaching to the hospital. So during 1918, 18th century, the Dominic Jean Larry, they are the person who started the EMS system, and they trained the people how to treat a patient in the pre-hospital setting and how to triage and how to treat them. So in the year of 1861, so American Civil War, so during the wartime, many people have injured. So from shifting the war zone to the safer zone, they use the horse carts. That is the second time they started using the ambulances. Then slowly it started developed. And in 1865, the hospital based EMS, that means a hospital started a EMS system and ambulance service to pick the patient from pre-hospital care, to treat the patient in the pre-hospital setting and shifting to the appropriate care. It has been started in the Chicago in the 1865. And in the 1899, so that is the first year when the ambulances are become automobile. So before that they are using the horse carts. Then later on they started using the automobiles like cars, vans, to shift the patient. That is also happened in the Chicago Marshall Reese Hospital. And coming to 1915, in the Korean War, they much more developed and they started the air ambulance, where they started shifting the patient through the airlift and treating the patient in the pre-hospital to save the time as well as to save their lives. So that is the brief history whatever we saw. Now many people have a doubt, what is the EMS system, what is their roles and responsibilities, what exactly they are doing. Comparing to the first EMS service and now whatever the roles and responsibility they are slowly graduated or they started grading themselves to treat the patient. So we discussed before in 1914, in the 14th century, only the EMS people or the ambulance service used to shift the patient, but now they have started treating the patient in the pre-hospital settings and they have given certain roles and responsibilities. So coming to the primary responsibilities, as an EMS or a paramedic people, we have so many roles and responsibilities, but we can categorize those roles and responsibilities in primary and secondary. So the primary roles and responsibilities are, one is the preparation and the second one is response, scene management, like whenever we are going to the scene, how we are going to manage the scene, and how we are going to assess the patient and how we are going to manage, and how we are going to transfer and what all the things need to be maintained when you are transporting the patient, and how we are going to document the case and how we are going to return back to the service. So we are going to see about this in detail. So first we are going to talk about the preparation. Preparation is one of the first and foremost thing that coming to the EMS or a paramedic. So whenever we are getting a dispatch information, the dispatch information is nothing but where we are receiving a call to go and treat a patient. So that whenever we are receiving a dispatch information, our first priority to preparing the ambulance, no, preparing ourselves. So ourselves we have to prepare physically, mentally as well as emotionally. And second thing, you should having a knowledge based on the scene. So whenever you are getting a dispatch information, we'll get to know what kind of scenario it is, what kind of emergency it is. So based on that, we have to have the knowledge and the abilities to handle the cases and preparing the equipments. So preparing the equipments is nothing but preparing your ambulance. So ambulance and the equipments preparation is one of the important thing, because sometimes what will happen, we will reach the scene but the appropriate equipment won't be there. And even sometimes the equipment will be there but the equipment is not appropriately working. So these are the things can land up in a difficult condition or challenging condition. So before dispatching, we need to check the equipment check, and whenever you can able to check, even during transit you have to check your equipments, because as soon as once you received your dispatch information, there is no time to prepare yourself. So this is how we need to check. So you have to check with all the equipments and whether they are working properly or not, and whether we need to have any additional equipments or not. And the second responsibility, the response. So how we are going to respond to the scene. So mostly we have two things. One is responding timely. Responding timely is as quick as possible you have to respond to the emergency. For example, there are some timely emergencies, we used to call it as, because if you are not reaching by the time, we may lose the patient. Like for an example, myocardial infarction, stroke, cardiac arrest. So these are the example of timely emergencies. We need to respond timely as well as respond safely. So why I'm telling responding safely is important. This is one of the scenario you can see. Sometimes due to the weather or the road condition or the weather condition, the ambulance can skid or can lead to an accident. So responding timely, how much it is important. Responding safely is also an important thing. And third is scene management. So the scene management is one of the important thing, because for example, always we are not going to respond to the home or to the safe environment. Sometimes when we are going, there may be a hazard. Either it may be a chemical spillage, or it may be explosion, or it may be anything. So that's why we'll always tell the paramedic safety is one of the important thing. That means the person who is the EMS person, their safety is one of the important factor in this. So first is our safety as a EMS and our partners. Then the second safety will be the patient or the patient accompanying like bystanders. And once this safety has been seen, then you have to assess the situation. Whenever you are feeling the scene is not safe, you have to shift the patient as quick as possible. And finally, in the safety measure, we need to take care of the body substance isolation. That is nothing but the personal protective equipments. At least minimal basic equipments like gloves, mask and goggles if possible. And the next responsibility, it's a patient assessment and care. So assessing the patient is one of the important things. So there are some protocols how you are going to assess. There are some mnemonics in which order you are going to assess. So whenever we are assessing the patient, we should assess in a particular manner or organized manner. So then only we won't miss any of the system. So sometimes we don't know, the patient may have one system, is due to one system the patient may be fall sick, and if you miss the system to examine, we can't able to diagnose the patient what he is going through. So it's always very important to do an assessment in an organized manner. Once you are doing an organized manner and you have to prioritize the patient need and the basic injury or illness, once you identify, you have to start treating the patient according to the illness or maybe the injury. And management, once we assess, then the second thing was according to the injury or illness, we need to manage the patient. So the management belongs to our scope of practice. So whether those skills are under the EMS scope of practice or not, whether if it's under the scope of practice, you can follow your protocols, or if it's above your scope of practice, then we can go for either radio or online medical direction. But always we need to inform the receiving facility that we are getting a patient so and so condition, be ready to receive the facilities. If we fail to inform the facilities, the facilities may not ready to receive the patient, or they may not have adequate facility to receive the patient. So it's always important to check the capability of receiving facility and informing them. And the patient transport report. So whenever we are trying to transport a patient from pre-hospital to in-hospital, that we have to fill the patient transport report. Once you arrive the scene and whatever the care you provided and whatever the injuries you assigned, injuries you saw to the patient, that we have to given to the receiving hospital, that the patient called to the ambulance service regarding this condition, and we assessed the patient, we found these are the signs and symptoms, and we gave this treatment. So that is one of the important thing that we need to in the patient care report, as well as we need to follow the patient privacy protocol. We should not disclose any kind of patient privacy related documents or patient details. Sometimes receiving facility may be very busy. Sometimes you would have seen, you shift the patient to the emergency department. The emergency department is already full, or it may be very busy. So you have to wait for certain time to give the handover. So the patient is one of the important thing. You should be patient while handing over. We should not tell I am getting late to my service or I want to hand it over very fast. It always won't work. So we need to wait, and we have to clear the patient history to the receiving facility, and whatever the treatment that we provided, then we have to return back to the service. And one of the important EMS responsibilities is documenting whatever we are doing from the dispatch information till giving the handover. We need to document each and everything. So for example, if you are transferring the patient, that it's very important that you need to document each and everything by specific things like a dosage, what kind of drug, when, the timing, and the route of administration also. So many of the times what will happen, you will hand over the patient and you forget to document what kind of treatment that you may give. Yes, sometimes what will happen, the receiving facility will be in a dilemma whether they already gave this care or we need to continue with the new care. So that time you need to give some kind of information in the document, what kind of treatment that we given. Sometimes we need to give the contact details of the EMS services. If the receiving hospital having any doubts, they can call and they can contact us regarding any of the questions. And apart from all this, the documentation will also serve as a legal record. So for example, sometimes there may be medical legal issues. They the case may land up in medical legal cases. The document will help to serve as a medical legal document. And the final and foremost responsibility is the return to the service. So always whenever we are done with the case and handing over the case, next thing is we have to return to the service. So every person on the EMS team is that responsible to restock. So in the first thing we have discussed about the preparation, right? So how to prepare is the previous person who handled the case or the previous person who used the ambulance, they have to restore or restock all the equipments whatever they used to the previous case. That is one of the important thing, because as soon as once you are returning to the services, that always you should remember that we need to respond to the next call as quick as possible. So how we can respond to the next call? By restocking all the equipments. Preparing for the next call is the first priority whenever you are returning to the services, and failure to do all these things can land up in legal consequences. So it's always the EMS responsibility to restore all the equipments as per the protocol. So that's all. Those are the roles and responsibilities that we've seen. Thank you.